Hi everyone. Within this second edition of the International Network of Biomaterials and Engineering Science, I have the pleasure to present this work about radiation risks during pediatric brain CT procedures in Morocco, a multi-center study. So, as we all know that heat CT is a fast and non-invasive method of imaging the brain and skull. It can be used after cerebral trauma to identify a skull fracture, cerebral edema, cerebral hematoma, and lesion or a cerebral pathology such as violent headaches or epileptic fits. So, it is evident that children may be more sensitive to radiation and have a longer lifespan, leaving them at an increased risk of cancer than adults. So, the purpose of this study is to evaluate the detriment associated with exposure during pediatric CT examinations. Throughout this study, 6 radiology departments equipped with different CT machines calibrated according to international protocols were used in this study. About 180 patients underwent CT scans of the head. Patients' parameters like age, sex, purpose of the examination, body region, and contrast used, and also the dose were collected. Other exposure parameters were taken into account, such as gantry tilt, voltage, tube current, exposure time, slice thickness, table increment, number of slices, scan positions on the patient, visualized CT dose index, and dose length product. The effective radiation dose, cancer risk, and genetic risk were evaluated using the risk factor coefficients of the International Commission on Radiological Protection. So, for the calculation of the effective dose during heat CT procedures, a conversion factor is used to obtain the effective dose for patients through the dose length product. So, the dose length product is calculated, or the effective dose is calculated by multiplying the dose length product by a conversion factor. In this case, the conversion factor considered is considered for the CT examination of the head, which is indicated in this slide. So, to estimate the likelihood of cancer and genetic risks, there are some equations to be used. So, the total cancer risk was calculated by taking the effective dose and multiplying it by the risk coefficient, which is derived from the International Commission on Radiological Protection. This conversion coefficient risk is shown in this slide for cancer risk and also for genetic risk. The genetic risk in subsequent generation was derived as the effective dose multiplied by the risk factor coefficient, which is shown in this slide. So, the effective dose for Moroccan hospitals is 2.7 millisieverts. The effective dose and risk associated with heat CT scans were above the average for 1/3 of the hospitals in this study, as shown in this figure. The cancer risk per per heat CT scan ranged from 42 to 428 with a mean value of 148 per 1 million heat CT examinations, and it is clear in that figure. The hereditary or the genetic risk per brain CT scan ranges from 2 to 16 with a mean value of 5 per 1 million heat CT examinations. The figure show clearly this numbers. So the estimated effective dose in this study is presented as a mean value for Moroccan hospitals. It is 1.86 millisieverts per heat CT procedures, and it is the highest compared to those found in other studies. So for patients aged 5 to 10 years, the risk associated with heat CT examinations estimated by this study from Moroccan hospitals is higher than the risk estimated by other studies included in this discussion. Although the likelihood of carcinogenic risk remains generally low, this comparison demonstrates that the risk associated with a CT examination in our hospital, and especially in pediatrics, can be optimized. The risk associated with heat CT examinations for patients aged 5 to 10 years estimated by this study for Moroccan hospitals is higher than the risk estimated by other studies included in this discussion. The likelihood of genetic or hereditary risks is quite low. This study shows that the risk associated with CT examinations in our hospitals, and especially in pediatrics, can be optimized also. So, as a conclusion, we can say that the effective dose and detriments associated with heat CT examinations are higher than the average for 1/3 of the hospitals subject to this study. The risk of cancer per heat CT examination varies between 42 and 428 with a mean value of 148 per 1 million heat CT examination. The hereditary risk per brain CT scan ranges from 2 to 16 with an average value of 5 per 1 million heat CT examination. This is significant when performing multiple image acquisition, so more than 66% of the procedures yielded normal results but remain high compared to other similar studies in the literature. So, personnel should optimize exposure to the lowest possible level during heat CT procedures, and a thorough manipulation of radiation and all associated equipment is needed to avoid or limit the risk of biological effects. Thank you for your attention.